I think it's a legitimate question to ask, well, is there mercury in there and is there a dangerous amount? I mean, after all, much of the food that we eat has small amounts of mercury, but we don't stop eating food. What we do is we say, well, there's an acceptable or safe level and there's an unsafe level. And there are different kinds of mercury, some that are inorganic and not of concern, and some that are. So the vaccine contains a type of mercury derivative that is not of concern. I'll have healthcare workers say, well, I was out with the flu. I say, oh, what kind of symptoms do you have? Because I know flu's not circulating yet. And they'll say, well, I had nausea and diarrhea. And I said, do you realize that if you were infected with influenza virus, it doesn't cause any of those symptoms? You had a GI virus, but because you're thinking of that as the flu, you think your flu vaccine didn't work. It's like saying, you know what, I got the hepatitis B vaccine and I still got malaria. Flu vaccine protects against influenza. It doesn't protect against the thousands of other respiratory and GI illnesses that circulate during the winter time. So we have to be careful about that. There's some history in our background in terms of how minorities and other ethnicities have sometimes been treated, and I'm talking now, you know, back in the 60s and earlier, in terms of informed consent and the quality of care that they received. I think we're past those days, fortunately. I think they're an embarrassment on our culture. I think people have reason to ask legitimate questions like that. What I can say from spending a career in the vaccine field is I have absolute confidence in the vaccine manufacturers. Healthcare workers want to know, since they're going to be the ones caring for people, that they're first in line to get the vaccine. They are. That's been decided. But here's the rub. We're not suddenly, in the midst of a pandemic where the number of infections and the number of deaths double every 3 days, suddenly going to be able to figure out how to give this to all the healthcare workers. And many of us are saying, part of pandemic preparedness is giving healthcare workers the yearly seasonal flu vaccine. In addition to all the other reasons we've talked about today, there's a preparedness issue here. Give it to them now, get them used to getting a vaccine, develop the policies, the procedures, the methods of deployment, expand the flu vaccine market so manufacturers are willing to make this, and then when, not if, when the pandemic actually occurs, we will have already worked out how to protect our healthcare workers so that they, in turn, can protect the community.
My name is Akinyele Ogunshi. I'm from Nigeria, West Africa. I've been working here for 4 years. The reason why I think people don't get flu shot is because of lack of knowledge and because of culture. People were raised growing up to only seek medical until they are almost dying. And this in turn makes it difficult for them to really appreciate the importance of preventative care. Now, when they get to the United States, where we have all these advancements in medicine, the culture is still in them that is so difficult for them to break out of that mode of seeking medical care until it's too late. For me, I am in the medical field and I get the flu shots every year. I get it because I know it's important. You know, prevention is better than cure.
My name is Marcia Fisher, and I'm originally from Trinidad. I've been working in healthcare for 14 years. In my country, the flu shot was not an option. It was never offered. But I do take it now every year because I have a school-age child, which I have to protect. Also, I have to protect myself and the patients that I work with.